Did you know that every year more than 15 million people worldwide have a stroke, of which 5 million die, and 5 million are disabled? You too can be one of them. A stroke is a medical emergency, and prompt treatment is crucial. Early steps can reduce brain damage and other complications. So guys, in this video, we are going to talk about some stroke natural prevention. But first, we need to know what a stroke is and how it occurs. A stroke is a serious life-threatening medical condition that occurs when the blood supply to a part of the brain is interrupted or reduced, which prevents brain tissue from receiving oxygen and nutrients. Brain cells begin to die within minutes. There are three main types of stroke. Number 1. Ischemic stroke. Mostly 87% are ischemic strokes. An ischemic stroke happens when blood flow through the artery that supplies oxygen-rich blood to the brain becomes blocked. Blocked or narrowed blood vessels are caused by fatty deposits that build up in blood vessels, or by blood clots, or other debris that travel through the bloodstream, most often from the heart, and lodge in the blood vessels in the brain. Some initial research shows that the 19th of December 19 infection may increase the risk of ischemic stroke, but more study is needed. Number 2. Hemorrhagic stroke. Uncontrolled hypertension and aneurysms, balloon-like bloating in an artery that can dilate and rupture. Protein deposits in blood vessel walls leading to weakness in vessel walls. Ischemic stroke leading to hemorrhage, a less common cause of cerebral hemorrhage rupture. There are two types of hemorrhagic stroke. Intracerebral hemorrhage is the most common type of hemorrhagic stroke. It occurs when an artery in the brain ruptures, flooding the surrounding tissue with blood. Subarachnoid hemorrhage is a less common type of hemorrhagic stroke. It refers to bleeding between the brain and the thin tissues that cover it. Number 3. Transient ischemic attack TIA or mini stroke. A transient ischemic attack TIA is sometimes called a mini stroke. It is a symptom of a temporary period similar to a stroke. A TIA does not cause permanent damage. A TIA is caused by a temporary decrease in blood supply to a part of the brain that can last up to 5 minutes. It's a medical emergency, just like a major stroke, because it is a warning sign of future stroke. Detecting and treating TIA can reduce the risk of a major stroke. Take urgent care even if you think you have TIA, because your symptoms are getting better. It is not possible to tell if you are having a stroke or TIA based solely on the symptoms. If you have TIA, it could mean a partially blocked or narrow artery leading to your brain. Having a TIA increases your risk of having a stroke later in life. If you or someone you have had a stroke, pay special attention when the symptoms start. Some treatment options are most effective when given immediately after the onset of stroke. However, we need to know the signs and symptoms of a stroke. Symptoms of a stroke include difficulty speaking and comprehending what others are saying. Confusion such as you may feel abusive speech or have difficulty understanding speech, paralysis of the mouth, arms, or legs, or numbness or paralysis. At the same time, try to lift both your arms above your head. If one hand starts to fall, you may have a stroke. Also, one side of your face may fall off when you try to smile. You may suddenly have blurred or black vision in one or both eyes, or you may see twice. Sudden, severe headaches, accompanied by nausea, dizziness, or loss of consciousness, may indicate that you are having a stroke. You may stumble or lose your balance. You may also experience sudden dizziness or loss of coordination. If you have noticed something like this in you, then you must understand that you are at risk of stroke. There are other things that can increase your risk of stroke. For example, if you are overweight or obese, physical disability can cause a stroke. Also, the use of illicit drugs such as cocaine and methamphetamine can increase your risk of stroke. If you suffer from high blood pressure, high cholesterol, diabetes, or cardiovascular diseases, such as heart failure, heart defect, heart infection, irregular heart rhythm, or heart attack, you may have a chance of having a stroke. A new study has shown that people who are infected with COVID-19 are also at risk of having a stroke. Another study found that people 55 years of age or older had a higher risk of stroke than younger people. A stroke can sometimes cause temporary or permanent disability, depending on how long the brain lacks blood flow and which part is affected. You may become numb on one side of the body or lose control of some muscles, such as on one side of the face or one arm. This can affect the control of your mouth and throat muscles, making it difficult for you to speak, swallow, or read clearly. Your language may also have difficulty, including speaking or understanding speech, reading, or writing. Many people who have had a stroke have some memory loss. Others may have difficulty thinking, reasoning, judging, and understanding ideas. They may also have difficulty controlling their emotions or become depressed. Pain, numbness, or other abnormal sensations in the affected body part. For example, if you lose sensation in the left arm due to a stroke, you may develop an uncomfortable tingling sensation in that arm. And for all these reasons, they may need help in their decoration and daily work. You do not want to be frustrated if you cannot get the right pitch, so invest in a good compo, let it flow in the trunk. So let's take a look at how we can naturally stay away from strokes. Control your blood pressure, diabetes, and cholesterol, because those are the #1 cause of strokes. You also have to treat better foods and do exercise. This is because a healthy diet and regular exercise will help you reduce your risk of high cholesterol, diabetes, and high blood pressure. Also, if you use tobacco, you should avoid it, as it will double your risk of stroke. So guys, stay healthy and stay with health conscious.